Welcome. Today we're diving into the bladder blueprint. We're going to build a really simple, clear guide to understanding your body's own plumbing system. How it controls flow and when things go wrong. So let's get right into it.
First things first, just a quick disclaimer. Everything we talk about today is for educational purposes. It is absolutely not personal medical advice. If you have any health concerns, please go talk to a healthcare professional. All right, let's just jump right in with a really interesting question. You ever notice how when it comes to bladder issues, they pretty much all seem to fall into one of two buckets? You've got the people who leak too easily, and then you have the people who can't seem to go at all. It's like the whole system can only fail in these two opposite ways. Why is that? Well, that's exactly what we're going to unpack. To figure that out, here's our game plan. First, we're going to build our blueprint and understand what I call the body's smart reservoir. Then we'll see what happens when that system fails. After that, we'll look at how doctors find the fault, touch on the prostate as a special case, and finally talk about how we reboot the whole system.
Okay, let's get to it. Section 1, the body's smart reservoir. Before we can understand the problems, we have to get a handle on the blueprint for how it's all supposed to work in the first place.
So the trick here is to forget all the complicated anatomy for a second. Instead, I want you to picture a high-tech, self-regulating smart reservoir system. Seriously, this one single analogy is the key to making sense of everything else we're going to talk about. And this whole smart system, it really only operates in two basic modes. First, you've got the storage phase. The analogy is simple. The reservoir fills up, and the valves stay clamped shut. The whole point is to hold urine without any leaks, even under pressure. And then you've got the voiding phase. This is the complete opposite. The reservoir gives a big squeeze, the valves fly open, and the goal is to empty everything out completely and right when you decide it's time. Okay, now let's put some real medical names on these parts. The wall of our smart reservoir, that's a really powerful muscle. We call it the detrusor muscle, and it's an incredible piece of biological engineering. It has to relax and stretch bigger and bigger to store urine, but without the pressure inside shooting up. Then, on command, it has to contract with serious force to get the job done. Now, any good reservoir needs valves, right? Well, we've got two of them. Together, they're called the urethral sphincters. The one on the inside is automatic. It works on its own. But the one on the outside, the external sphincter, well, that's the one you have conscious control over. That's what lets you hold it. It's your manual override. So who's running this whole show? Think of your nervous system as a control panel with three main commands. The store command comes from your sympathetic nerves. They tell the reservoir wall to relax and the internal valve to stay tight. The P command comes from the parasympathetic nerves. They do the exact opposite. They tell the reservoir to squeeze. And finally, you have the somatic nerves. Think of this as the squeeze command. That's your conscious voluntary control over that external valve. Okay, so we've got the blueprint down. Now let's see what happens when the system starts to have, well, let's call them glitches. This brings us to section 2, where we're going to look at those two basic ways the whole thing can fail.
And this brings us right back to that question from the beginning. It turns out that pretty much all lower urinary tract symptoms fall into these two categories. You have storage problems, which are all about not being able to hold it in. The glitch here is either that the reservoir is overactive and twitchy, or the valves are just too weak. On the upside, you have voiding problems, not being able to empty. And here, the glitch is usually a blocked outlet pipe or a reservoir muscle that's just too weak to push effectively. Let's zoom in on those can't-hold problems for a sec. We can break down incontinence or leakage using our reservoir analogy. First, there's stress incontinence. This is like having a weak lid on your reservoir that pops open with any pressure, like a cough or a laugh. Medically, that's due to weakness in the urethral sphincter or pelvic floor. Then there's urge incontinence. This is like having a twitchy, oversensitive tank that just squeezes whenever it wants without your permission. The medical term is detrusor overactivity. And finally, there's overflow incontinence. This happens when the tank is so full because it can't empty properly that it just constantly overflows a little bit at the top. Okay, so if the system is glitching, how do we figure out exactly where the problem is? That leads us to section 3, the diagnostic toolkit.
The initial workup is actually a pretty logical step-by-step process. First and foremost, you listen to the person's story. You're trying to figure out, is this a storage problem or a voiding problem? Then a physical exam can give you big clues, like feeling a bladder that's really full and distended. A simple urine dipstick test is a great quick screen for things like an infection. And then there's the bladder scan. This is so important. It measures the post-void residual. Basically, it tells you exactly how much urine is left in the tank right after someone tries to empty it. It's the best way to know if the system is truly getting empty.
Now, in men, there's this one extra piece of the plumbing that's so often involved, it really needs its own section. So let's move on to section 4, the prostate, a very special case. See, the prostate gland sits right at the base of the reservoir, wrapping around the outlet pipe. And two things commonly go wrong here. First is benign prostatic hyperplasia, or BPH. This is a non-cancerous enlargement that slowly kinks that outlet pipe, causing voiding problems. It usually happens right in the middle of the prostate. Prostate cancer, on the other hand, often grows in the outer part of the gland, and that location is key. It means it can grow for a long time without causing any urinary symptoms at all.
And that, of course, brings us to one of the most common and maybe one of the most misunderstood blood tests out there. So what does a high PSA level really tell you? Well, here's the crucial thing to remember. PSA stands for Prostate-Specific Antigen, not Cancer-Specific Antigen. Yes, a high level can be a red flag for cancer, but a whole bunch of other less scary things can cause it to go up. BPH, that simple enlargement we talked about, can do it. An infection or inflammation called prostatitis can do it. Even things like recent ejaculation or not being able to empty your bladder can raise it. So it's a really important marker, but it is not a diagnosis on its own.
All right, we've figured out how to find the glitches. Now for the most important part. How do we fix them? Let's get into our final section, rebooting the system. Management almost always follows this stepwise approach, kind of like climbing a ladder. You always start on the lowest rung first. That means lifestyle changes. Simple things like adjusting your fluid intake, managing your weight, or treating constipation can make a massive difference. If that's not enough, we move up to targeted training, things like pelvic floor muscle exercises, which are basically like strengthening the valves, or bladder training, which helps to calm down that twitchy reservoir. Only after that do we start thinking about medications. And procedures? Those are really reserved for when the other steps just haven't been enough. And medications are the perfect example of how we tailor the treatment to the specific glitch. If you have an overactive bladder causing urgent continence, the goal is to calm that twitchy reservoir muscle. So we use drugs called antimuscarinics, which basically block that parasympathetic P signal. But for an outlet blockage from BPH, the goal is completely different. We need to unkink the pipe. So we use alpha blockers, which relax the muscles around the pipe and help open it up. And that really drives home the key takeaway from all of this. You have to treat the mechanism, not just the symptom. Just addressing a symptom without knowing why it's happening, it's just not going to work long term. The real key is knowing exactly what your goal is. Are we trying to calm down a twitchy reservoir? Are we trying to beef up some weak valves? Or are we trying to clear out a blocked pipe? It all comes back to the blueprint. So I'll leave you with this final thought. Now that you have the bladder blueprint, the next time you hear someone mention bladder trouble, you can start to think like an engineer troubleshooting a system. You can ask yourself, okay, is this a problem with the reservoir itself? A blockage in the pipes? A failure in the valves? Or maybe a glitch in the wiring? Because figuring out which part of the system is failing, that's always the first and most critical step to finding the right fix.